we really thought that what we were doing in Leeds was something special. We were trying to address an intractable problem that's been around for, I think Jackie would say, for about 40 years, more, for longer, and it wasn't changing in terms of thinking about reduction in detention for Black and Asian men in mental health services. And so we thought, we started working with the Synergy Collaborative. We're using different methodology, creative methodology, to tackle a really intractable problem, and working with everybody here. You see, is coming from different organisations, different professions, thinking we really want to make a difference. Let's talk about what's happening in our city. Let's talk about racism. Let's talk about discrimination. Let's talk about the things that matter, that we think are barriers to good mental health and access to services. And that's what we've been doing for the last 7 years.
Yeah.
7 years, and we're starting to see a change and a difference in our services, and our communities are saying this feels different.
And we've actively listened to people, so we've paid attention to the voice of lived experience and carers to ensure that what we're doing is working for people, and this has worked. Because we've done that work and we know what people are saying to us, and we're working towards that, achieving better results in mental health, making sure that we change the systems that currently don't work for people.
And just one more thing I want to add to this. A big part over the 40 plus years in terms of mental health is the inability to share best practice, that considering that it is a similar picture across nationally, is silo working. And what this is an exemplar of is collaboration and trying to dismantle the hierarchy of language in relation to discrimination, and being inclusive of intersectionality. And the fact is also honouring those who were doing the work way before systems have been failing us, and others have been saving us. And it's now time to acknowledge the work that was done and the framework that was already established. And so I think this is a model that others need to take, because institutions are not just buildings, they're people. Well, the thing is, this hasn't happened in isolation, because the whole thing, like Sharon said before, it was part of a 5-year, it came out of. Leeds was already doing its own work. Notice there was an issue, and it's always used the word complex or wicked problem. I was part of a national initiative independently funded called the Synergy Collaborative Centre with Professor Kamaldeep Buri and Professor James Nasru and Words of Colour. And then we worked with Leeds, Manchester, some of whom is ironic, the Midlands, who featured today. We were working with the Midlands in Birmingham Solihull Mental Health Trust, NHS Trust, with different systems in London, and also in Manchester. And the thing is that just even get people around the table to talk. And then what we found, the creative spaces model, which is also underpins a lot of this work about use of creative methodologies, everyone was saying not just that they wanted to adopt it. The interesting thing is, it was how then do they speak to their health and wellbeing board? How then do they, it's almost like you need coaching to go into the system that you're working in and not ask for permission, saying this is what's necessary. And a lot of the time there's a lot of passion, but it's about how then there's a lot of lived experiences we're dealing with here. There's a lot of people in mental health who are burnt out, emotional labour being taken for granted, yet they still want to be heard. So you've got the lived experience who are meant to be represented, and then you've got those who are meant to represent those with lived experience. And they're stymied, and they don't know how to speak the language. And people don't know how to be brave and not be bystanders around racism and what they see. So I think that the model is transparent. It's always been inclusive. And I think if people want to run for it with it, we're not precious about it. It is there for them to use, to take into account their local legacy, because no two people's legacy, local areas' legacies is the same.
But
So,
but it's worth adding that I think the PCREF, I think for me, you asked, where are we going for the next 3 or 5 years? I think this winning this award gives us a platform to say, this working in this way makes a difference.
Yes.
We've shown that.
Yes.
And I think with the PCREF, the Patient Care Rated Quality Framework, this is an absolutely brilliant framework to drive that change. You have a model of how you can really seriously address racial inequalities in mental health.
Yeah.
and I think this kind of will attract more funding. I think for, as you know, for an area of mental health that's underfunded,
Yes.
we're proof that this can work. And so that's what we are so pleased for this, because we can go back to Leeds and say, look what we're doing.
Yeah.
It's been recognised.
It's
It's recognised in our system.
Yeah.
To be fair,
Yeah.
we've had real support from our system
Yeah, we
leaders
have.
here. But I think we can really drive this home and think about a wider impact. So yeah.
Yeah, now we need to make an impact and take action on this, because now we can.
And I just want to bring Marvina in here just for one thing, because one thing that is really key is about the next generation,
Young people.
right? Because it's no point being innovative and it has no bearing on the next generation in terms of prevention. And the work around children and young people is key, so they have the language in relation to this, so they can not just demand better, but they can actually think about some of the solutions for themselves and feel they've got the agency to do that.
And if you have anybody talking about this work in this way, it would be interesting, because I think the way we talk about the work is very different.
And I think what's really important is the synergy approach in the heart of everything. It really makes sure that we are allies to the children and young people. Without the synergies and innovation, we would not be able to have like mental health leads for children and young people, which then looks at putting strategic leaders in challenging positions to actually think, what does equity look like? What does racial trauma look like? And part of the synergy approach is now allowed us to do the first racial justice, a racial trauma inspired kind of post to make sure we look at racial harm to our health inequality, and using the creative spaces, using voice and influence, and us knowing what allyship looks like for children and young people, because our children's voices matter.